Okay, I am going to be demonstrating how to put in and discontinue a Foley catheter on a male patient. First off, I'm going to read through some of the procedural steps, and then I will show you on the mannequin. First off, you're going to look into the patient's chart, make sure the doctor has ordered it, what type of Foley. For a male patient, you would position them in the supine position with the legs extended and the thighs slightly abducted. You perform clean wash to the perineal area and place drapes where appropriate. The actual catheterization is sterile, but you would use your clean gloves beforehand to make sure everything is clean before you do the actual sterile procedure. Like I said before, you look at the chart to confirm the order and retrieve the correct size and type of catheter. With male cleaning, you will use the non-dominant hand gently and to grab the penis at the shaft below the glans and hold the shaft of the penis at a right angle to the body. This hand is going to stay there for the remainder of the procedure because it is sterile. You're going to use circular strokes around the meatus with your dominant hand, which is the sterile hand at this point, when you go to insert the catheter. The procedural steps for the actual catheterization is lubricate the catheter's end and get the vial of solution ready to place to the holding ball where you would insert that solution. With the dominant hand, place the catheter at the urinary meatus and advance until you see a flash of urine, and then administer your vial of saline and hold the placement. Make sure to use a leg band to support the catheter if any pain was associated with the insertion, you would document that and or contact the doctor to maybe get it discontinued or see what other avenues to take. You will always place the catheter bag lower than the bladder. Gravity always wins is kind of the rule. Chart what was the output and the size and what kind of catheter. Make sure, because if it's not documented, it wasn't done. So you would enter the patient's room, let them know what you were going to be doing, and then provide privacy. And then we go down and make sure, just like the procedural step said, make sure that you have direct access and the legs are spread apart. You can take your Foley catheter, which would be the right size and everything. You would double check that. With a female patient, I know I'm doing male, but with a female patient, you would want to make sure that you bring in 2 catheters just in case you did accidentally insert it into the vagina. You would leave that there, so you would have a better idea of how to get into the meatus. Since this is sterile procedure, you have a 1-inch marker on the outside of your field here that is non-sterile. And then this is your drape that we will put on the patient. Okay. And then these are your sterile gloves. So you would don sterile gloves. And remember to bring an extra pair into the room in case sometimes these don't fit right, sometimes they can be a little pain in the butt. Right now. Oh, really? And with your sterile gloves, now this is all sterile, so you are allowed to touch this. You have not contaminated anything yet. You get your Foley out and make sure everything. Okay. And with your little kit here, this is your saline that you're going to administer for your bubble. These are your swabs that you're going to use for specimen cup in case you need an initial urine, and then your petroleum jelly. You will open this up and put this down here. And while you're getting the patient ready, what I like to do is leave that sitting in the jelly. And now I'm going to clean the perineal area. You have 3 swabs, and with this, here, there. Now, with your non-dominant hand, you'll grab the penis at the base of the shaft and hold it upward. Now this is a contaminated hand now, so you will not use this because you will break sterility if you change position of that. So with your dominant hand, you will take one of the swabs, iodine swabs. You will start at the meatus and work yourself out. And then toss. Once again, outward circular motion down, toss. And the third one. And then toss. And then you will take the catheter with your dominant hand, insert it into the penis until you get a flash of urine, which we'll pretend like we got one, and you grab your sterile, with your sterile hand still, you will grab your saline and administer this into, and then you will make sure that you feel a little resistance back, and then that means that it's in place. And with that, and then if you go to, once it's in, you have to make sure that if you go to take it out, then it's done. Make sure this is down. Now to DC it, you would come back in. This would be empty. You would bring this 10 ml vial back in to this, and it would suck back out whatever was in that balloon. Make sure you try it a couple times that all of it's out. Unhook it, and you're going to let them know that there's going to be a little sensation, and pull it straight out. And that's how you do a male catheter.